Upper respiratory disease in cats: causes, symptoms, treatment, and case study. As a cat owner, you want to keep your furry friend healthy and happy. One of the most common health problems that can affect your cat's well-being is an upper respiratory disease. Upper respiratory disease, also known as URI, is a contagious infection that affects a cat's nose, throat, and sinuses. In this article, we will discuss the causes, symptoms, treatment, and case study of upper respiratory disease in cats. What causes upper respiratory disease in cats? Upper respiratory disease in cats can be caused by a variety of viruses and bacteria. The most common culprits are feline herpesvirus and feline calicivirus. These viruses can be transmitted through direct contact with an infected cat or through contact with contaminated objects, such as food and water bowls, litter boxes, and bedding. Other factors that can increase the risk of developing upper respiratory disease in cats include stress, poor nutrition, and overcrowding in multi-cat households. What are the symptoms of upper respiratory disease in cats? The symptoms of upper respiratory disease in cats can vary depending on the severity of the infection. Some common symptoms include sneezing, runny nose, watery eyes, congestion, coughing, loss of appetite, lethargy, fever. If left untreated, upper respiratory disease in cats can progress to pneumonia, which can be life-threatening. How is upper respiratory disease in cats diagnosed? If you suspect that your cat has upper respiratory disease, it is important to take them to the veterinarian for a proper diagnosis. The veterinarian will perform a physical exam and may recommend diagnostic tests, such as a blood test, urinalysis, or cultures of the nasal discharge. How is upper respiratory disease in cats treated? Treatment for upper respiratory disease in cats is focused on relieving symptoms and preventing secondary infections. Depending on the severity of the infection, the veterinarian may prescribe antibiotics, antiviral medications, and/or eye drops. In addition to medication, it is important to keep your cat comfortable and hydrated. Provide plenty of water and a soft, warm bed. You can also use a humidifier to help ease congestion. Case study: upper respiratory disease in a cat. To better understand how upper respiratory disease can affect a cat, let's take a look at a real-life case study. Lola is a 3-year-old domestic shorthair cat who lives in a multi-cat household. She started showing symptoms of upper respiratory disease, including sneezing, watery eyes, and congestion. Her owner, Sarah, took her to the veterinarian, who diagnosed her with feline calicivirus. Lola was prescribed antibiotics and eye drops to help manage her symptoms. Sarah also made sure to keep Lola comfortable and hydrated, providing plenty of water and a warm, cozy bed. After a few days of treatment, Lola's symptoms began to improve. She was back to her playful self in no time. Conclusion: upper respiratory disease in cats is a common and often treatable health problem. By being aware of the causes and symptoms, you can help keep your cat healthy and happy. If you suspect that your cat has upper respiratory disease, it is important to seek veterinary care right away. FAQs: can humans catch upper respiratory disease from cats? No, upper respiratory disease in cats is not contagious to humans. Can upper respiratory disease in cats be prevented? While there is no surefire way to prevent upper respiratory disease in cats, keeping your cat's environment clean and reducing stress can help reduce the risk.